Thank you. Okay, so we're going to bring up our next panel, talk about Healthier You, the status report and state pilot program, and want to welcome Ruth Holton Hodson, Senior Policy Advisor, Health and Retirement Initiatives from the Treasurer's Office, Vaughn Walker, President of SEIU Local 1000, representing our wonderful state employees, Ralph Cobb, Assistant Chief, Benefits Division, Cal HR, and Karen Johnson, Chief Deputy Director, Department of Healthcare Services. Welcome. And I understand you guys have it all coordinated, so I'm just going to let you guys run, and then when you're done, we'll ask questions then. Thank you.
Well, good morning. Good morning, Chairman Pan and Cooper and members. I am Ruth Holton. I'm the Senior Policy Advisor for Health and Retirement Initiatives for State Treasurer John Chung. And I served as Controller John Chung's top aide responsible for implementing his vision for a statewide employee worksite wellness program, which became Healthier You. We really appreciate and thank you for this opportunity today to sort of tell you our story. It's been a really exciting, adventurous ride, somewhat like being on a roller coaster, but we've had, I think you will hear today, and hope you agree with us, that we've had some really tremendous results. But I'm going to sort of share a little bit of the history, and then I will pass it on to Yvonne Walker, who will talk about it from the labor's perspective. Ralph Cobb will talk about it from Cal HR's perspective, and then I am delighted that Karen Johnson could join us because she's been a key member of our team from the beginning, and with Department of Health Services to say what it's like to have Healthier You in a work site. But first, just a little history. Healthier You began at the depth of the state's budget crisis when the PERS board was looking at every way it could to reduce state employee health care costs. And Treasurer John Chung, then State Controller, challenged PERS to explore prevention as a strategy for reducing costs. Helping employees stay healthy, he believed, would be a win-win for the employees and the state's fiscal health. So to make the case for prevention, we always know we have to start with data. We first commissioned a study by the Urban Institute, funded by the California Endowment, to do the first ever cost analysis of PERS's expenditures on health conditions preventable with improved diet and exercise. And I think the results were startling. 362 million, or 22.4% of PERS's 2008 expenses were on chronic diseases from preventable conditions. For male state workers in their 50s, it was 35% of costs, and for females, it was 27% of costs. Of the most common conditions, per capita cost for hypertension were almost $1,600 a person extra. For diabetes, it was almost $3,000 extra per person. The study projected that a 5% reduction among state employees in the prevalence of preventable conditions could save $18 million annually. Just a 1% reduction could save $3.6 million annually. These are numbers that compared very favorably with other cost-cutting measures that PERS was exploring at the time. We know that poor health, as has been mentioned by the earlier panel, doesn't just affect the state's healthcare expenditures. Average duration of SDI claims were up 41% to 16 weeks from 2007 to 2012. The number of employees accessing EAP services was up 21% from fiscal year 2010 to 2011. And about 50% of the state workforce retirees retire earlier than planned, giving poor health as the main reason. And as you may know, retirees who retired before eligibility for Social Security and Medicare cost the state far more in health care costs than state active employees. With the data in hand, we went to the state treasurer, Cal HR, SEIU Local 1000, and PERS with a proposal to develop a model worksite wellness program designed by state employees for state employees that creates and sustains a worksite culture of health. PERS gave the go-ahead for Kaiser as part of their PERS contract to work with us on the program design and implementation. They have been terrific partners, not only providing significant financial and personnel resources, but their expertise and counsel on the development of successful labor and management partnerships has been invaluable. Given the state of the state budget at the time, we turned to the California Health Funders, and they too, in turn, stepped up to the plate, and we're very grateful to the California Endowment, Cal Wellness, the Sierra Health Foundation, and the California Healthcare Foundation for the support they gave us both in developing the model and in implementing it. So today, as I said, we're delighted to be here to share with you our model and our accomplishments. And to start that with the storytelling, let me turn it over to Yvonne Walker, President of SEIU Local 1000, to begin the discussion. Thank you, Yvonne.
Good morning, Dr. Pan, Assemblymember Cooper, Assemblymember Cooley. Appreciate this hearing and the importance of achieving wellness in the state workforce. Before I start, though, I can't emphasize enough that this program and project would not have been successful without having partners. Karen Johnson was invaluable. She immediately said, yes, we want to do this here, and weighed in and was helpful. From Ruth, Ralph, Sarah Zimmerman on my staff. So that it really is about partnership and doing it together. And so I do want to lift that up. Healthier You for us is part of the direct result of values that Local 1000 believes is important for our members. It gives them the opportunity to have a good life, enjoy their work and their workplace. We believe it's a form of social and economic justice. We believe that part of the purpose of our purpose is to live a good life, and that includes wellness. And Local 1000, we would pursue this goal with any key leader or organization that shares this value. We got involved in this pilot project because we knew that it was a different way to engage with our members, other partners, and with management. Working with CalHR, the State Controller's Office, State Treasurer's Office, CalPERS, DHCS, and CDPH through Healthier You. We have been able to establish a new way of doing things and a new way to relate with one another with one purpose in mind, the wellness and health of state employees. We know and believe that healthy and happy state workers are productive state workers, and our members provide quality services to California. We also know that healthy habits such as eating healthier foods and exercise improve overall well-being. We don't believe this is rocket science, and so far our members' feedback supports this. I'd like to share with you a story that one of our members provided who works in the East End complex. She said, I'm a 53-year-old grandmother of 4, and I am also a recent widow. My energy level was down. I was sleeping all the time. I was gaining weight after my husband passed away 2.5 years ago. I realized that my life wasn't going to get any better unless I made the effort to make it change. When the Healthier You program came into effect, I figured why not? I was encouraged by a good friend and coworker to join her Healthy Trails team. So glad I did. Lost a ton of weight and probably got back to my high school weight and fitting in the clothes I never thought I'd fit into again. Yay. Thank you, Healthier You. Thanks to this program, I am now a healthier me. And that was Regina Shoemaker, and she's a DCHS employee and a Healthy Trails participant. So we believe that the initial success of Healthier You has largely depended on the voices of the employees being present at every step of the process. We have had employee input all the way from the design and engagement team at the initial stage of the project to our current advisory committee. We have also had boosters, volunteers who engage in healthy activities in their work area and create a wellness community by doing so. These boosters have done part of the hard work to engage with their fellow coworkers to change the dynamics of their work area and to create a healthier environment and a healthier culture in their department. Throughout this pilot, we have learned a whole lot about how employees want to engage with their employer. As a union, we have also had a different way to connect with management and find common ground with other partners to create a different environment for the people we represent. We are actively looking to expand Healthier You at Napa State Hospital. This will be a completely new work site with its own set of challenges given the non-traditional work schedules. In doing so, we will develop a deeper understanding of what it takes to create a sustainable wellness program throughout the state. As we expand out, we must continue the work that began at the East End complex. Each department, DHCS and CDPH, has now hired a full-time wellness coordinator that will continue to drive the work that happens on wellness. And we will be there every step of the way, continuing to support the departments as they create a sustainable program of health for all their employees. And I will tell you, I look forward to this continued partnership. Ralph, I'll turn it over to Ralph Cobb.
Good morning, Dr. Pan and members of the committee. I'm Ralph Cobb, one of the founders of Healthier You, and currently Assistant Chief of the Benefits Division at CalHR. And Healthier You pilot activity began in late 2012 with the California Department of Public Health and the Department of Healthcare Services at the East End Complex in Sacramento. It involved approximately 4,000 employees. The pilot was intended to run for 2 years, however, was extended for a third year thanks to Kaiser and CalPERS to obtain an additional year of health screenings and other data. To build a culture of health, we focused on implementing 2 large interventions annually with some additional smaller interventions in between. And those smaller interventions are developed by the on-site Healthier You Labor Management Committee that Yvonne referred to. And the first large intervention was the first annual health screenings, and we did that first so that participants could learn about their health status and so that we could have a baseline to track whether Healthier You was having an impact on health outcomes. And these screenings involved having medical professionals on site to take blood collection and other biometrics. And over the past 3 years, over 4,000 health screenings have been done at the East End Complex. We're pleased to report that health screening results from 2013 to 2014 showed improvements in key health measures, including blood pressure, blood glucose, total cholesterol, and body mass index. We're currently analyzing the data from the 2015 health screenings. The second type of large intervention focused on increasing physical activity, fruit and vegetable consumption, and water consumption. And these interventions involve 8-week campaigns where individuals or teams recorded their physical activity, fruit and vegetable consumption, water consumption, using a wellness program service provided and funded by Kaiser. This includes a web interface where that provides employees with peer support and enables competition between teams, divisions, the 2 departments. And the recording of activity also provides us participation data and the ability to conduct pre- and post surveys to measure behavior change and program effectiveness. And comparing Healthier You participation rates with other Kaiser wellness pilots involving other CalPERS employers, Healthier You has consistently outperformed other pilots, and sometimes by some pretty large margins. For example, in Healthier You's first large physical activity intervention, 31% of the East End Complex employees participated. In 4 other, and this activity was the Thrive Across America intervention. And 4 other pilots that also used Thrive that year, the best performer hit 20%. And in the first year of health screenings at the East End, 48% of employees there participated. And in 4 other pilots that also did screenings, the top performer hit 15%. And Healthier You did this without any financial incentives. And we really ascribe our high participation level to the key role that labor plays in organizing and communicating with their membership. So between the large interventions, we had several smaller interventions, including things like healthy food preparation and cooking demos, running workshops, stress management classes, and Sneaker Fridays, where employees come to work with brightly colored laces in their sneakers, and they get out and walk together. And what we found sustainable is to run no more than 2 large interventions per year, interspersed with the small ones. because this is really the optimal activity level that keeps employees engaged, but without burning out either participants or those who are putting together and conducting the activities. So while I've focused on the specific wellness activities that we conducted at the East End Complex, I also want to emphasize kind of what Kaiser talked about, that, Healthier You is not just a series of worksite activities. We're not about having a Biggest Loser program. We don't provide financial incentives, and we're not a wellness program in a box where we just hand something to the department and say, here. Healthier You is an approach to worksite wellness that builds a culture of health within the participating department, and that's what makes it sustainable. Building on what Yvonne said, we also focus on identifying policies and procedures that create barriers to a healthy workplace. We require the leadership to be engaged. We engage employees at every level of the organization in designing and implementing a program that works for them. And we support employees in meeting their personal health goals. So now I'll hand off to Karen Johnson, who will provide insights on Healthier You from the departmental perspective.
Good morning, Dr. Pan and members of the committee. I'm Karen Johnson, Chief Deputy Director, Department of Healthcare Services, and we were one of the fortunate sites to be able to stand up the Healthier You. Just want to reemphasize everything that you heard this morning, especially about the strong partnership that was needed in order to have this successful program. It has had a tremendous impact. As you heard one story, there's been countless stories. I walk in the hallway, employees are thanking me for standing up this program. It brings awareness to employees about their overall health, and also allows for them to do some interventions to improve their health. So what did we do to implement? Some of the things, first, it was frequent communication and buy-in at the leadership level. So it was imperative to drive that cultural change. So we had the director, Jennifer Kent, who is an avid runner, and also other executive members who are also active participants. We also encourage staff to participate in the various activities. Healthier You is also a standing agenda item that we have on our bi-monthly managers and supervisors meetings. We also have a newsletter that we also have a Healthier You corner. We also now have a full-time employee who is dedicated to implementing the Healthier You activities with public affairs assistance to help spread the message via multiple channels. While culture shift is initiated at the executive level, measurable change requires that staff also embrace this effort. DHCS and CDPH staff have partnered together to conduct fitness classes. We have had over 1,000 employees who have registered for those classes. Participation in wellness programs and activities is voluntary. But efforts are ongoing to reinforce the importance of wellness and its role in healthy work-life balance. We also conduct a director's walk. Our director, Jennifer Kent, leads monthly walks for employees around the Capitol Park. Due to its popularity, we had to create a sign-up. We also have Bike to Work Day. Directors, chief deputy directors join this Bike to Work Day along with our CDPH colleagues, and we bike to work. We also have a bike share program. 293 employees have participated in the bike orientation and are registered to use the bikes throughout the course of the workday, whether to exercise at lunchtime or whether to ride a bike to get to a particular meeting. More than 1,450 trips has been taken since May of 2014. We also have an organic produce service based in Yolo County that makes weekly deliveries to the East End Complex in West Sacramento. A monthly subscription yields employees a bag or a box of organic fruits and vegetables each week. We also have lunchtime healthy cooking demonstrations. We also created synergy with other wellness outreach efforts: breast cancer walk, March of Dimes, suicide prevention, state employees food drive, Run to Feed the Hungry, the Turkey Drop, and Mental Health Awareness Month. As I mentioned, our director Kent is an avid runner, and she has challenged employees to join her in some of the friendly competitions and different races that she competes with. So tapping into the team spirit to encourage participation and competition in wellness activities is very important. May is Bike Month. Each year, we enter into a friendly competition with our CDPH colleagues, and although they prevailed last year by 8 miles, I do have to say this year there's going to be a comeback. So also the annual on-site wellness screenings, as you heard, was well attended, and overall helps keep employees focused and engaged in activities to improve health. All in all, Healthier You has been a tremendous impact. I've received calls frequently from other chief deputy directors from other departments asking, how can I establish a Healthier You program? Thank you.
Hey, well, thank you. Thank you all for the wonderful presentation. Question?
Well, I just wanted to finish up by kind of giving a roadmap of where Healthier You is headed in 2016 and beyond. As we have from the outset, we're taking a strategic approach so that expansion is built on a solid foundation to ensure success and sustainability. You know, we're moving forward on 3 tracks intended to converge in the coming years, with Healthier You becoming the state's wellness approach system-wide. So the Healthier You pilot will continue to be our primary research and development strategy. Like others have mentioned, during 2016, CDPH and DHCS are going to expand throughout all their work sites statewide, and we're also establishing a new pilot site at Napa State Hospital. Those will help us learn how to operate and implement in a decentralized environment, which is common to many large departments, and then in the 24/7 shift work and in a highly secure environment. And also Napa will involve additional labor organizations in Healthier You. And so these expansions are already getting underway. The second track is what we're calling Healthier You 2.0. And this involves implementing Healthier You at a couple of medium-sized work sites without the intensive outside support from Kaiser. And that will enable us to perfect how to operationalize what we've done at the East End complex in an efficient and cost-effective manner. And we're already beginning this Healthier You 2.0 implementation with the Office of Statewide Health Planning and Development. And we hope to recruit a second site in the coming months. So with all of CDPH plus Napa plus OSHPD on board by the end of 2016, the number of state employees under Healthier You will exceed 10,000. The third track is taking what we've learned at the East End complex and pushing some of that out to the other state departments via the existing network of departmental wellness coordinators. And this will enable departments that are already conducting wellness activities on their own to benefit from what Healthier You has taught us and lay important groundwork that should help Healthier You roll out more efficiently in the coming years. You know, a couple of key enablers for these efforts are the development of a Healthier You toolkit, which is already well underway. Another is the procurement of a wellness service provider of the type that's proven so instrumental in success at the East End complex. And we currently have a BCP in the 2016-17 budget proposing funding of $100,000 for 2016-17 and $250,000 ongoing for implementing this service statewide. And this will be coming before the budget subcommittees for approval. And this is really essential to support expansion of Healthier You on all 3 of the tracks that we're pursuing. So I want to close by reiterating that Healthier You is not just a rolling out a program or activities. It's system change and creating a culture of health within our workforce. And we thank you for the opportunity to speak with you today, and we're available to answer any questions you may have.
Excellent. Well, again, thank you. Thank you so very much. Questions? Is everyone cool? No? All right. So I have a couple questions. First of all, in terms of evaluation, you talked a lot about the process and so forth. Is there an evaluation that's being performed in terms of how, health outcomes? Actually, you talked about how what we spend on chronic diseases, but it's back to the
So,
reducing costs, so forth.
Happy to answer that question. That has been something from the beginning. So we actually started this project with some funding from the California Healthcare Foundation to design an evaluation, because we didn't want to design an evaluation at the end. We wanted to design an evaluation at the beginning. And then with the help of the Sierra Health Foundation and their evaluation expertise, we even put together sort of all the kinds of metrics that we would need in an evaluation. We contracted with UC Berkeley Labor Center, and again with support from the Sierra Health Foundation. We have a person who's actually winding up his evaluation of the impact of this approach on employees. The challenge that we're facing, one of my personal challenges throughout this entire project, is finding sufficient funding for the type of evaluation that we need on the healthcare, on actually the healthcare metrics. And Kaiser would actually be able to, and I said, they can certainly look at the Kaiser population specifically, but what we wanted to do was to look at the population overall. One of the things that actually spurred us to do this project in the first place is we understood that PERS data can be broken down by bargaining unit. And so it was like the light bulb went off and said, okay, let's work with one bargaining unit, SEIU Local 1000, and then be able to compare the results and put together a comparison group that we could do. So we have actually gone out and we have talked to various groups, including RAND. RAND has said they'd be able to do this for us for about $200,000, but we haven't found anybody to fund it yet. So, but that the great news is that we continue to collect the data. So it's not like, and the more data we have, and in fact, I think that it would have been premature to do this kind of study last year. Now, with 2015, we're going to have 3 years of data. 2016, obviously, we'll have more data. But we now have, so what we can rely on right now, though, that's also important, is the wellness screenings that we've had annually, so we can look at the baseline and see how it moves forward. And as Ralph said, we've seen very positive results. So it would be very exciting to see over time how that compares with, taking the subset of the East End complex and then comparing it to some kind of other population.
Well, certainly doing that analysis, I think, would be of great value to the state of California, which has a budget of how large? Okay.
We
All
can
right.
dispute that.
All right. So, and how much do we spend on health care? We just heard from PERS. And so all right. So we should definitely look into that because clearly I think there's an opportunity, especially as we try to take this to scale. And I guess that's my next question. And I appreciate the presentation at the end about what the path is. So we have, right now what I hear is we have DHCS, we have CDPH, we're going to Napa, we're going to try to Ashpod, maybe another site. Is there, and I realize there's also wellness programs you mentioned in other agencies, departments. Is there a goal to, whether it's this program or in terms of wellness overall across different agencies and so forth, is there a goal to try to eventually get to you said 10,000 employees, that's a lot of people, but state employees a lot more. Yes.
One of CalHR's strategic plan objectives has been to implement evidence-based wellness programs for our workforce. We have a legacy wellness program that its inception was back in the 1980s, and both technology and science has come a long ways since then. So I think what we're doing with Healthier You is learning that one of the big barrier, the big challenge with implementing workplace wellness in the state isn't that we don't know enough about health. It is the environmental and the policy. And barriers, they're not so much barriers other than we've got to learn how to work in these different scenarios and be able to teach the departments and work with the departments. So each step with Healthier You is building on what we've already done to get in, to be viable statewide. We have to get into the prisons. Well, the state hospital was a natural stepping stone to teach us what we know. OSHPAD is taking what we've already learned in a similar environment to the East End complex and figuring out, okay, how do you operationalize it and make it real rather than just a pilot. And so each step we're going will enable us to further roll out. Like, for example, with Napa, if they're implemented successfully there, state hospitals can implement it in the rest of their facilities. And so we're looking for ways of taking that kind of approach so with a reasonable resource commitment, we can have a wellness program that has enough impact to move the needle instead of just enough to be able to say we have a wellness program.
No, and I really appreciate that approach. And I guess that also goes back to, well, we need the evaluation results too, right? So I see how these are linked together. And but certainly, I think also in terms of thinking about other agencies and so forth, you're right. There's particular circumstances with that you're looking into if you move into corrections or other types of things. There's also, I think, perhaps other agencies that are more similar to DHCS and CDPH that maybe are less health oriented, but there's some opportunities there as well. But I appreciate the approach that you're taking to be sure that we do it on evidence-based approach, and we certainly need to look in being sure we get that evaluation data because we do want to take an evidence-based evaluation approach to this. And I guess finally, obviously, some of this stuff isn't just about what happens within a state office building, because you talked about bike to work and other types of things as the state senator represents this area. And I know that I have colleagues here, Senator Cooper. Cooper represents South, and Senator Cooley has. Please let us know what we can do to try to help out with our local governments and so forth, because we want to reduce those barriers for our state workers to be able to do some of these activities that happen in our communities as well. So if there's things we can do there, that let us know. So.
Thank you.
Thank you.
Oh, you're welcome. Actually, I want to welcome Senator Morlock. Welcome. And actually, any other questions from committee members?
No, for the
okay.
Senator Morlock, more of a comment. We just heard about a health-based program, Healthier You, based in the East End complex, focused on a single bargaining unit, which has developed a 3-year track record of data based on health tests and other sorts of things. So they've got 3 years worth of data on how the program has worked. We'll have a 4th year of data this year. And the comment is that they're needing $200,000 so that the Rand Institute Santa Monica could actually start looking at that data and boiling it down and drawing some conclusions. So we actually have had a pilot that has been underway, and we're at the point now to be able to, sift through the data and reach some conclusions that can help the general issue of wellness in the workforce,
Okay. Well,
which is what the chair is speaking to.
Thank you,
So,
Senator
Mr.
Cooley.
Chair,
Yes.
is this the final panel?
No, we actually have one more
Okay,
panel.
okay,
Yes.
thanks.
So I think
Because at the County of Orange, we also focused on this when I was a supervisor
Right.
for 8 years, looking at wellness programs. So I apologize for having a conflict. I had another
That's-
joint committee hearing at the same time.
I appreciate you being here right now. And again, there's a handout, and be happy to update your office as well. But again, I want to thank you so much. We're very much looking forward to continued progress in the program, and appreciate you bringing up some of the things that we can be helpful in helping continue this. Thanks very much.
Great
Thank
to
you.
see you.